Greetings, I'm Professor Yang Seung-min. For surgical treatment of peri-implantitis, you can do flap surgery or bone graft, and various methods can be used. You need to check the healing response after non-surgical treatment before proceeding with surgical treatment. In this lecture, I'm going to talk about how surgical method is determined for implant treatment, as well as treatment options. The contents of today. I'm going to talk about the decision tree for selection of treatment method. Next, I'm going to talk about types of surgical method. In general, they can be open flap, resective surgery, regenerative surgery. You need to determine whether you're going to remove or regenerate. After that, I'm going to summarize. There can be many different factors that affect how we're going to provide treatment. The first thing to check when the patient comes in is to look for mobility. If there is mobility, it's a failed implant and therefore it should be removed. However, if there is no mobility, you need to check the level of bone loss. If there is bone loss, depending on the severity, you can decide whether to keep or remove the implant. In making the decision, if bone loss is beyond half that of implant body, rather than keeping it, it is better to remove it. It is better to start from scratch and meet the conditions necessary for implant placement. On the other hand, if it is less than half that of implant body, in that case, you need to check the level of bone loss. If bone loss is less than 2 mm, if it is 1 to 2 mm, you can use non-surgical method first, check the response first before making the decision. If it exceeds 2 mm, say 3, 4, 5 mm, and if the bone loss is less than half that of implant body, you can use surgical method and environment for simple oral hygiene. Or you can choose to restore it and balance it with the adjacent environment through bone regeneration. Another category is mobility, as shown. Mobility is most important. Absence or presence of mobility is very important. If there's no mobility, you can do gradual treatment. In order to make smart decisions, so you can choose non-surgical method first to check the response. If the response is good, then that is ideal. If it is not, you need to figure out what is the reason behind it. You need to check if the cause is due to horizontal or vertical bone loss. And then, depending on the cause, determine whether you're going to do regenerative or resective surgery, or whether you're just going to clean it. You need to make such decisions, and after that, if the disease stopped progressing, we need to do maintenance treatment in order to prevent recurrence. I believe we can differ our approach depending on different causes and symptoms. Even though it can be classified into different ways, I believe it is the gold standard to do first, non-surgical method, second, surgical method, third, maintenance care. That'll be the most ideal option we have at hand in terms of treating peri-implantitis. As mentioned before, the purpose of treating peri-implantitis is to block out inflammation. We need to remove bacteria and microorganism, which is the cause of plaque, and we need to make the implant surface to its original clean state, removing the inflammation that is attached. Using these methods, we'd be able to reduce the possibility of recurrence. Among different options we have, the surgical method is most effective. It has best results. We don't resort to surgical method immediately. We first do non-surgical method, do re-evaluation, check whether the conditions are stable or whether it is progressing. You can take surgical method after evaluating all this. As mentioned, there are still not that many of evidence to determine which is more effective. As a result, we need to gradually proceed with treatment step by step to get the desired outcome. Let's look at the purpose of intervention. Surgical method can satisfy all these factors. So should we just resort to surgical method to accomplish these goals? Rather than that, we need to apply non-surgical method first. Surgical and non-surgical method can be divided as shown. Surgical method is done after non-surgical method is performed. Therefore, even if you do surgical method, bear in mind that non-surgical method is required to detoxify the implanted surface as well. Do take note of this. Let's look at types of surgical method. First option is open flap debridement. You can open flap and approach the defect area and remove the contaminants after flap elevation. It's quite simple. After that, another option is to use resective therapy along with open flap debridement. You need to be aware of the different types of resective therapy that can be used. Are you going to grind off the implant surface or remove the bone around the implant? Or the pocket that has been formed around the implant? You need to consider these factors. Final option is to do open flap debridement along with regenerative therapy to regenerate the bone that has been destroyed around the implant. When you make a decision as to which option you're going to use, you need to have a set of standards. You need to look at patient's systemic health and whether the patient can maintain oral hygiene well after treatment. Implant type or the level of bone loss around the implant needs to be considered. Various factors need to be taken into account. The most important thing is to consider whether the patient is going to be able to maintain oral hygiene and follow instructions. Even if you have done a great job, if the patient cannot maintain it properly, it may have been all for nothing if it is not maintained well. Let's look at clinical case. In the upper right, posterior area, extraction was done, implant was placed. Using the traditional method, prosthesis was provided with time. The oral hygiene deteriorated, and after 2 years, and after approximately 5 years. When you compare the two images, you can see that probing depth is much worse and there's bone loss as well. If you look at the amount of bone loss, this is vertical bone loss. It was very difficult to regenerate. I just opened flap and removed the cause of contamination. Surgery was done and this is the result. You can see that it is well maintained and it's not getting worse. However, if you look considering the standards of implant surgery, you can see bone loss exceeds half that of the implant body. It's kind of in the gray area. You can see it's over half or less than half. If I have had used a decision tree, I believe I should have removed the implant. However, the patient may not really want implant removal, or removal in itself can be a stress. So I just open the flap and remove the contaminant to improve the condition. I'm not following up with this patient currently. I believe how long it will be maintained will ultimately depend on how the patient maintains oral hygiene well. The patient is not participating in the maintenance and care program. I really hope that things were maintained, but I suspect that things deteriorated. So there are many factors that affect whether the disease is going to exacerbate even after treatment. The first is oral hygiene. Whether the oral hygiene is good or bad makes all the difference. I've talked about prevalence of Peri implantitis. Smokers are 2 times more prone to Peri implantitis compared to non-smokers. Smoking also affects whether there is going to be recurrence of disease or not. You need to check a patient's oral hygiene as well as whether he or she smokes or not before you determine whether you're going to use surgical or non-surgical method, or to remove the implant entirely. Please bear these in mind as you choose your approach in terms of treatment. In terms of resective treatment concept, let's look at the indications to apply resective treatment concept. The first is horizontal bone loss. So this is not a vertical defect which is shaped like a triangle, but it's a horizontal defect. When it is very difficult to augment bone vertically, resective surgery may be more favorable to the patient. Let's look at a case. As you can see, the implant placement itself was not ideal. Prosthodontist did his or her best, but you can see that there's pseudo pocket and soft tissue has thickened significantly. Inflammation has continued to occur. Non-surgical method was used for treatment after that. You can see that the swelling has improved somewhat. It was very difficult for the patient to brush teeth on this side. I recommended removing this part. If you look around here, inferior to the crest, there's a little bit of bone. There's bone up to the margin between implant body and abutment, and there was a lot of bone. I didn't think it would be favorable for oral hygiene, so I removed it. Now, bone graft is now made possible. It's now fully open. As it heals, I made a path where interdental brush can be used. Compared with the initial visit, you can see that in some cases, embrasures have disappeared. As you have seen earlier, I did non-surgical therapy, and as swelling died down, this appeared, and after surgical treatment, it was expanded. I believe this depends a lot on the surgeon's experience. Also, the original state of the patient condition, the amount of bone around the implant, whether the patient smokes or not, how much is the probing pocket depth at patient's initial visit. These multiple factors affect the treatment. I am saying this repeatedly, but non-surgical treatment method can also be applied to surgical treatment method as well. How well can this be applied to the contaminated surface? Is there a difference when we open flap or not? These need to be considered. Another way is to remove the implant surface itself. Mechanically, this can be favorable. However, when we remove it, how does it affect the strength of the implant? This can be of concern. After you grind it off, will the particles of titanium cause inflammation in the adjacent tissue? These factors can be troubling. However, up to now, there's no report saying that these issues can lead to complications. So you can keep these in mind. There are many positive findings, however, as you grind off the implant surface, some may be concerned that the thickness may be reduced excessively. There are many tools available so that even if you grind it, you can maintain the form. It's a good idea to use these. After implant placement, you can see that there's Peri implantitis all around. When I removed the crown, you can see that the condition doesn't look good. When I opened the flap, you can see that there's bone loss. I used tools like abrasive to do detoxification on the surface. I did bone graft. In other words, I did regenerative therapy. And then I did bone augmentation like this. I checked how well it was maintained. You need to achieve balance with the adjacent environment, and this is the key to regenerative therapy. You may think that regenerative therapy is better than resective or open flap surgery. I wanted to look at some literature to check which was better. There are not a lot of literature that directly make comparisons. I found one such study, and in that study, titanium granule, which is a special bone graft material, was used. When titanium granule, a special material, was used in the study, it was difficult to pinpoint which was better between resective and regenerative therapy. However, if conditions were different, for example, if xenograft, synthetic graft, or autograft were used, I think the results could have been different. Because there are not that many research on this, I am very cautious about coming to a conclusion on this issue. Let's look at the marginal bone level. Regenerative therapy shows better marginal bone level because bone graft is done. Regenerative therapy is better for defect fill as well. However, in terms of pocket size reduction and response towards inflammation, there were no major differences. In terms of BOP reduction at implanted site, there were no major differences as well. Therefore, I am very cautious about reaching a conclusion because there's limited study result. It is difficult to say which is better between regenerative and resective therapy. It's still too early. I believe that in determining which is better, the most important criteria is the purpose. The purpose of treatment is to halt progression of disease. In addition, if you want to restore function, you should use regenerative therapy. If the primary purpose is to halt the progression of disease, because in terms of inflammation response, there was no difference between the two. Therefore, the goal should be kept in mind, and maintenance and care is very important. Let's summarize. In treating peri-implantitis, the key point is to remove the contaminants off the implant surface regardless of the measure you use. You can use chemical method or physical method, mechanical method, remove bacteria, Regardless of the approach you take, you need to detoxify the contaminated surface. That is most important. After that, you need to include the patient in the maintenance and care program and monitor constantly to prevent the recurrence of such disease. Thanks to many attempts in regards to implant treatment, the accuracy has improved significantly and treatment period has reduced. A lot of technical developments have been made and patient convenience has been improved. However, peri-implantitis patients are growing. In order to address this, surgical method is very important, but you need to understand and bear in mind the importance of maintenance and care program. Thank you for watching.